Okay, roll call. We're going to go each table just to make this expeditious and give everybody a chance. We've got Judy and Kelly charting for us. So let's start with North Carolina. What's your burning question? I got you before you put your sandwich in your mouth. Do we have a mic? Okay, give me your burning question. I'm going to be... Okay.
Funding. We have a question about funding and the estimated per child rate that might be funded through this opportunity.
Okay, funding and the estimated per child rate. Where am I at? What state am I at? Oregon. What's your burning question?
Recommendations about neutral facilitation between state systems and Head Start potential applicants in having conversations about how to support each other. Okay. Potentially build or other folks.
Other folks. Perfect. All right. Is another state at this table? Yep. Okay, go ahead, Washington.
We have a lot of little questions, but I think what we're doing right now is trying to figure out how to operationalize sort of a state hub of resources that would be available to individual applicants. So we have a multitude of questions around how to operationalize that.
Perfect. Question. What state? No, not Tracy.
In Minnesota, we're thinking about the shared state resources and how to remain neutral and all of the things that everybody else has already talked about.
We have an Illinois burning question. What kind of scale is needed at a local level to operate this program?
Okay, Michigan.
So in Michigan, our burning question is similar to some of the other states of specific ideas about how to serve as a resource for folks who are writing this grant and the types of resources, technical assistance they're bringing to folks in the state to write successful applications.
Right. Got it? Burning question. And what can Bill do to help? Okay.
We had heard there was a minimum of 72 children, Ohio. We wondered if there's still a minimum number to be covered in the application.
Kansas, I'm coming your way. It's already been said?
Already been said, thank you.
Okay, good.
Burning question? No? No? Oh, yes, okay.
You have a burning question? Burning question?
Me. Colorado, one of our burning questions is still in terms of the role and responsibilities from a state level, still looking at a possible maybe statewide application process and then supporting local communities and existing programs that might also be applying, and just all that goes with that, all the resources and support that are needed to actually do quite an extensive federal application.
In New York, our question is how our state can support grantees, especially in addressing the challenge we have being in a state that has a state-supervised, county-administered child care subsidy system. We have very special challenges around syncing early Head Start and child care eligibility.
I think our question is similar to one that was raised earlier, but in a large state, how can you align multiple levels of application, state, regional, and local, to common goals?
California.
So Georgia wants to know who in this room will share their actual budgets so we can do a uniform cost model based on provider type, based on urban or rural setting, and blended income models. And if we had some real financial data, some of us could really work on that and then share it with all the states.
So this is, I have a question, which is, how can we use this amazing moment in history to take a giant leap forward in compensation parity for people working directly with children?
This is Connecticut's question. We have incredible opportunity with a new governance structure in Connecticut, but how do we take advantage of the authority we have now to make some significant changes, but how do we time that with the rollout of the application and all the things that need to happen to really support providers at the community level?
Burning question? Okay. Burning question? I'm here. Hi, all my friends.
Probably left up to states, don't you think?
Okay. You got one more, Susan? Okay.
Florida. I guess our burning question is how will monitoring be conducted between federal and state and federal and federal?
Okay, great. Did we miss anybody? Did somebody think of a question after the mic came your way? We have one more. Okay.
This is a question for Wisconsin, and I'm a group of one, so I guess it gets to be my question. So I know that members of our association are very interested in what kind of technical assistance supports are going to be available from regional offices, and if those supports will be ramped up, given that childcare will be new to this, and there's some work that grantees can do to teach childcare partners, but some of that really needs to be additional supports.
Perfect. Thank you. Trust that Bill looks at all this information, and you'll get another round at this at the end after your team time. But we're really trying to figure out what are the next steps, how we can be helpful with the vast number of partners that we have, and make sure you get what you need in order to take it to the next level. So I'm missing Janice. We're about to do the financing panel, and we're really lucky to have really 3 different perspectives in terms of that work. We have Ann Mitchell, who's the president of the Early Childhood Policy Research and co-founded the Alliance for Early Childhood Finance. She's written widely on early care education policy, finance reform, and system building, and has worked with more than half of the U.S. states, a dozen foundations, as well as federal agencies and national organizations. And in my work in Massachusetts was really invaluable when you ask questions about, well, what's the cost of quality, and how do you think about who pays for what, and what does really drive the program costs up. So we're happy to have Ann, and we'll start out with her. And then we have Miriam, who many of you know and have seen throughout the day. And I'm not finding the right page, to talk to you about the DC experience and how they manage their their Head Start grant, and then what are the lessons from how she budgeted in DC around Head Start that we can then later, is somebody, shh. I'm hearing voices in my head. How she then budgeted around DC, and what lessons does that give us from preschool that we can apply to infant toddler. And then we have Janice Grindell with us, who I've worked with in Connecticut and worked with on my Massachusetts work, who's done a lot of budgeting and work at the state level in Connecticut, who's really going to give us another idea, another way to think about this. A lot of this is about the application. It's also about the state role, but it's also about the big ideas on financing, and so she's going to leave us with that. So we're going to start with Ann, go to Miriam, and then Janice, and then, of course, we'll do question and answer.
All right, so in theory, this microphone is on and you can hear me. Is that true? It is true. All right. All right, let's see if we don't need that. All right. I've been saying to people that this meeting has sort of exploded my head in terms of. So I'm sort of reframing somewhat what I was going to say to you and doing it in light of what I've learned over the last 24 hours. But basically, I don't care whether we call it layering or blending or braiding or weaving or knitting or whatever. It doesn't really matter to me, because the real deal is we need more resources to finance the services and systems that children and families deserve, and we got to be more efficient with the resources we currently have, and that means that we have to share costs to support quality. So that's true, and I really don't care. You can call it whatever you want. In 2011, a group of us wrote a little treatise called Better Policy, and it was really these 4 ideas, which is we need to quit making policy by funding stream. We need to put children first, put child development first, use a common standards-based quality framework, by which I mean a quality rating improvement system that covers everybody. We have to share costs so we improve efficiency and support quality, and we got to use data to drive quality. So that was what we thought in 2011. I still think that. After yesterday and today, I still think that. Because now we've made a lot of progress on building early childhood systems in our states, and when we build those systems, they're for all the families. They're not just for some families, they're not just for certain kids, they're for all the families. And we care about the whole ball of wax. We care about child development and education, and we care about mental health, and we care about family engagement and support. So in those systems, that's what we want to have happen. And it's like every state agency has something to contribute and stands to benefit from being part of that system. And every local service provider, same, has something to contribute and stands to benefit. So pay no attention to the details on that slide. This is a very old graphic that Louise and I have used for a long time, and I think we did it first in Pennsylvania a long time ago. And the idea in this is saying, look, what we've got here is lots of state agencies, and if we agree on that part in the center that we're going to use one common framework for quality, and we're going to build our standards for learning and programs and practitioners into it, then every agency has something to contribute. And now I think we can expand on what each of those is, because there are places in the health agency that contribute, there are places in all of those. But when we're building our systems, we're imagining that all of our state agencies are going to be players. So when I think about, I'm going to go back to this because that's a much more pleasant picture to look at. That's my grandson, Henry. I have permission to use this picture. I'm very careful about that. So when I'm thinking about the early Head Start child care partnerships, this is an opportunity to advance our state systems if we use it that way. And I don't really care. I don't think it matters whether the state's the grantee, the state's a partner, the state's writes letters of support. There are ways that the state can use this opportunity to advance our system building. Because states have resources, that's what that other slide was. We have communities where we know we need to do better, and so those can be our pilots, our innovation zones, our empowerment zones, whatever you want to call them, but those can be the places in which we try to do this better. And so we care that the applicants in our state are going to be making things better in certain places. And we're, as a state, going to try to help that work. So it's an opportunity to model some of the things that we want, like regional hubs of support for all kinds of providers, not just early Head Start, not just childcare, but maybe we can figure out how to deliver health services more effectively if we regionalize, if we have county-based systems, we use that. So it's like we have an opportunity here. And I've said this in all of the sessions that we just had, but it is really true that the states control almost every aspect of CCDF, Child Care and Development Fund, Child Care Subsidy Policy, and we control all of state pre-K policy, which matters because we're talking here about 3-year-olds and where they're going to go next. We control much of early intervention and early childhood special ed policy in our state, so we really do have a lot more control than we sometimes feel like we have. So we have an opportunity here to simplify and make better our policies so that they support families better, they support quality better, and they're going to be easier to blend. It's an opportunity to advance really wonderful solutions to tough problems. I was so glad to hear Billy talk about compensation, because we have the opportunity, if you use these early Head Start funds properly, you can improve the compensation for all of the people working in any program that has to do with that early Head Start Child Care Partnership grant. And that becomes a beacon. That becomes a beacon of this is possible. We know how to do it. We know how much it costs. All we got to do is figure out how to get the money for the rest of us. But having solutions in our midst is a huge part of getting to where we want to go. The one thing that I really want us to take away from this, whatever we go home and do, even if it's just think more about this and not doing, I want you to reframe this tension about access versus quality. I want you to say what we care about is access to quality. Access to quality. Say it with me. Access to quality. I will never pit access against quality again. Raise your hand. If you are an advocate, I want you to raise your hand. I will never pit access against quality ever again. Because the reason that states aren't going to change their policies is that they feel like they're going to get beat up by the legislature. It's going to say, this is going to cost so much. Where are we going to get the money? And they're going to get beat up by the advocates who say you're going to see fewer children. So it is really important that you take this pledge. So I'm not a complete Pollyanna. I know it's really hard to do this. I think the fact that we are talking about it is the first step, and then it may take a long time. But we do have opportunities. In certain states, you have opportunities to use these partnerships for small pilots of how you might change things about your Medicaid plan, things about your CCDF plan, and do it on a small scale, make sure it works, and then you have the experience to go bigger. So this is what I want the partnerships to do. I want you to put children first. I want you to share costs. I want you to innovate and be bold. But to do this, you got to trust each other, you got to be honest, and you got to really respect one another, because that's the only way we're going to do this. Thank you very much. Oh, Sherry says I'm allowed to take a couple questions. If you have no questions, just take the pledge again. And, yeah.
Okay, we'll come back.
We'll come back.
I just wanted to make sure.
All right, thank you.
All right, thank you. Hope everyone can see me. I always have to make a joke about my height when I stand behind a podium. So I'm going to talk about the Head Start school-wide model. As Sherry said, this is an approach in pre-K, but the idea was that it would sort of demonstrate an innovation with respect to blending resources that might be useful and applicable to Head Start. This model was put in place for the early Head Start child care partnerships. The model was put in place in 2010 during my tenure as the director of early childhood education at DC Public Schools. I'm happy to say the program is still active and working and continuing to improve each year as folks get more ideas and more experience with how to do it. Before I describe the model, though, in keeping with the theme of partnerships here, I want to acknowledge a few people in the room that really helped to make this possible. Joan and Yvette and the federal staff in Region 3, who I think saw the potential in this approach and committed to figuring out how to make it work. Dana Jones is our Head Start partner in the District of Columbia. Dana showed a lot of vision and a lot of risk. Thank you, Dana. When we started this, about 40% of our Head Start funding came through a delegate grant to our school district from Dana's organization. We were a deficient program at the time. We were definitely on the recompetition list, I'm sure. And Dana took a chance as did all of the feds, in believing that a program that was not doing well at meeting the Head Start performance standards for 1,782 kids would do much better at being able to meet the Head Start performance standards for 5,000 kids. It was a little bit of a stretch. In fact, Dana said to me, when I explained sort of the whole vision, he said, well, I think if what I understand you're doing, you're going to do universal Head Start in the school district at all of the Title I schools, so that sort of changes my business model, and I think I need to do more early Head Start. And we said, great. And we figured out ways that we could help him do that, like giving space in the schools for early Head Start and in the high schools. And so we figured out how to make it work. So what is the Head Start school-wide model, and kind of what was the vision around it? First is that at the time we started conceiving about this, we were going through a rapid expansion of pre-K in the District of Columbia. Our current mayor was then the chair of the council, and he was the architect of a universal preschool bill that made high quality, very high quality, really well-resourced pre-K available for all 3- and 4-year-olds, paid through the student funding formula. So we saw, and we didn't have a facilities issue, right? We had space in our schools and our charters and our traditional pre-K, so we saw rapid expansion of locally funded pre-K. That started to create some challenges within Head Start at the school. As you can imagine, for families, they were walking through one door, their neighborhood school door, and weren't really realizing that depending on who they spoke to first, or what door they happened to walk in, they were going to get a dramatically different early childhood experience. One that met the Head Start performance standards, or one that met the pre-K standards. And sometimes, I'm not going to lie to you, there was even competition, even though everybody worked for the district, between, the Head Start folks felt like, the ones that were funded out of the Head Start grant felt like they really needed to get those Head Start income eligibles and get them into the classrooms, and that the principals needed to help them. And the principals felt like, they wanted to fill their own slots and their own enrollment, their own classrooms, right? The principals didn't own the Head Start program. From where I sat, there was a big problem, and that we started to look at some data and realize that we had so many more Head Start income eligible children than those that were being served in these classrooms that were labeled Head Start. So that was kind of first vision. How do we get more children, particularly about 1,500 to 2,000 more children that we were already serving in pre-K classrooms, to get a Head Start-like experience with the comprehensive services and the quality? So that's something that we wanted to accomplish. The other one was accountability. So the principals not owning those Head Start classrooms, I like to call it the Head Start opt-out provision. So when the Head Start staff were like, you got to do this, you got to serve the food family style, they were like, I'm sick of Head Start. Next year I'll just open pre-K, and I won't have Head Start in my school building. So that was a problem. Equity was a problem. We were labeling kids as poor in a public school, right? You're in the poor kids classroom, right? Even though we had lots of Head Start income eligibles in pre-K, we were labeling children. We were labeling the families. They were having to prove other things like income eligibility and bring other paperwork. Often they didn't want to do it, and they said, you know what, I'm not bringing my pay stub, I'll just go through the other door. And then resources for quality improvement. We wanted to look for efficiencies. So if the district really owned pre-K, and if it was one program, we could do things like renegotiate the food contract and say, you know what, for all pre-K, you have to do family style. And we could eliminate a position, true story that we had, where we had 3 people that had to run around and try to convince cafeteria staff to prepare food family style for a certain subset of classrooms, right? So we could repurpose those dollars and start to put them to use in other ways. And then we wanted to really leverage the strengths of pre-K and Head Start. So mentioning we had 2 different programs with 2 different visions. The pre-K teachers would say, we're the program that's focusing on literacy, we're getting kids ready for kindergarten. Those teachers over there are changing diapers and playing. And the Head Start teachers would say, we're developmentally appropriate, we're working with families, we're meeting the needs, you know, those teachers, developmentally inappropriate. We wanted to take the best of both models. Okay, so this is how we tried to do the money part. So we wanted to build one early childhood program. How did we do it? We took a very generous cost per child that we got through the student funding formula, and we said this covers the slot, right? So it covers the cost of the teachers and the aides in Head Start and pre-K classrooms in all Title I schools in the District of Columbia. The Title I schools was sort of our marker because of the way the city is divided economically. The Head Start the Title I schools were our best proxy for reaching all those additional 1,500 to 2,000 Head Start income eligible children. And then we said the local funds are also an in-kind contribution, are contributing to this model, right? The principal, the custodian, the staff at the front of the office that are doing the intake and enrollment. Often we had school-based social workers. I will say that at some point in working through this with the regional staff, it was almost impossible to truly calculate the full contribution of the district and the local funds in this model. We stopped at like school-based FTE and square footage. And with that, we were able to determine that for every federal dollar, that there was a $3 investment in local money into the model. And then what we said is the money that we got for the children that we served, this was our funded enrollment before we did this, the same amount of money for serving 1,782 children, we were going to use to raise the standards up for 5,000 children, including providing comprehensive services and funding quality improvement. So the federal funds is really like a pot of quality money that we sprinkled over all of the Title I schools. It funded a cadre of 30 early childhood instructional specialists that worked and coached principals, that coached teachers. It funded master's level case managers to work with our families, right? We were really able to step up our game. And other quality improvement things we did, we replenished classrooms and materials and supplies to get a lot of our pre-K classrooms, interestingly enough, up to the same kind of quality standards in terms of the environment and the materials in the environment from our Head Start, that our Head Start classrooms had. So an important idea here is that the feds agreed that it was okay for the Head Start monies to be used in this way in support of quality in all of the Title I schools, as long as we ensured that every single child met the Head Start performance standards, right? So everybody had to meet the Head Start performance standards, and that our local contribution far exceeded the federal contribution in this model. So these are some of the lessons learned based on the guidance. So I can't say enough about the risk and innovation of the federal staff in Region 3, and I'll just thank them again in case they're watching. I didn't expect that I was going to call, a deficient grantee was going to call the federal Region 3 office and say, we want to do this really innovative thing. We haven't been meeting the Head Start performance well. And they would say, okay, we want to talk to you. So it was a true partnership. Every challenge that we encountered along the way, we figured it out together. And it was, things were humming along, and we were designing our program, and then it got to the grants management people, and it was like, So a lot of these things are based on the lessons that we learned from the grants management folks. Funding sources needed to be distinct and traceable. We could clearly show that what the local effort was, and that we were far exceeding the 20% required non-federal match, and we had to sustain that local investment, right? So if we calculated instructional staff as part of our local contribution over time, we weren't gonna, as part of the federal contribution, the teachers as part of the local contribution over time, we weren't gonna start using the federal dollars to fund those instructional staff. That's, again, supplement, not supplant. We needed to show that the federal funding was paying for additional quality improvement enhancements So we were taking things to another level above and beyond the things that we did in the past before. This was really important for us from the Head Start side because we had a school leader at the time, you might know her, Michelle Rhee, who was negotiating these really different teacher contracts. I like to say we probably had some of the highest Head Start highest Head Start / pre-K teachers in the nation, highest paid at DC Public Schools. And so Head Start was trying to keep up with those salaries out of our grant, and so other quality improvement things were suffering. Technology from the classrooms, sort of curriculum, professional development monies. So we had to show that we were doing new things and things that we weren't doing before. This is an interesting one. We had to show that we were drawing down our money based on our funded enrollment monthly. So the easy way to think about this is that we had to earn our money. Not that everybody doesn't earn their money, but in Head Start you can draw down funds according to your costs, based on your expenditures in advance. We had to draw down our money every month based on demonstrating that we met our funded enrollment of 1,782 children. And then the way we like to think about it, we did cost allocation at the school level, right? Or it's the program level, as I've heard people talking about it over the last 24 hours. So we account for the federal dollars in the categories listed. Our costs are looked at very closely and in our internal controls to ensure that we're expending on our quality improvement efforts and all of our work to kind of go up to the next level and meet the Head Start performance standards for more kids. So hopefully that's helpful. Look forward to questions. Yeah, are there any questions?
Do the Title I kids meet the income eligibility?
So do the Title I kids meet the income eligibility? So of around 5,000 children that were served, pre-K age, that were served across all of our Title I schools, we estimated about 2/3 met the income eligibility. But in order to get our money, we only had to demonstrate that our funded enrollment met the income eligibility. Pay stub, yeah. How did we prove income eligibility? Basically, the question is, how do we demonstrate income eligibility? That's a great question. I was thinking about that earlier. We were trying to do everything to not have families have to bring pay stubs into the public school, and so we got really creative. We worked with the state, and we determined all of our categorically eligible. So we went to the McKinney-Vento, we went to CFSA. That was sort of easy. Homeless, foster, anybody who was categorically eligible for Head Start, we got that first by not having to ask the parent directly from the state. I even went to the Office of Tax and Revenue to try to see if they could use W-2s. There was some tricky things. I won't go into the difficulties of the Office of Tax and Revenue, but that didn't really work. And then for what we ended up doing is eventually notifying families that if we got close to not being able to show the 1,782, we were going to, it was kind of like a notification that we were going to need to ask them for proof of pay stubs, right? But it wasn't kind of at the front door. We tried to do everything we could to get the proof for the 1,782 by going to alternate sources. And actually, the Office of Tax and Revenue did help us once we got the Social Security numbers of the families and able to show documentation of proof of income eligibility that way. So it was a combination of lots of things, but there wasn't, there were times when we knew we might have to go directly to families.
So I just want to say super innovative, so amazing. I have a question about what effects there were on the program, because in partnering with around the country, partnering with in elementary schools, often the elementary school K-5 approach is sort of driven down to early childhood. And I was wondering, especially in this mode where everything is the same, if you could just comment on what happened in terms of your curriculum and developmentally appropriate practice, and how, did you see any learning by the kindergarten teachers from early childhood back and forth?
Thank you. That's another great question. When I said we wanted to take the best from both models, often the thinking was, well, the best is just the comprehensive comprehensive services, right, from Head Start, but pre-K's got it locked on, what good instruction looks like. And that, wasn't the case. We were very focused on early literacy, and we weren't looking at comprehensive, whole child approaches. And so the Head Start standards helped with that, right? The education standards in Head Start helped us really broaden. So a perfect example is we brought a formative assessment into the district, and as part of our quality improvement efforts across all these classrooms. Now, the Head Start classrooms had it. Now, if we didn't have the Head Start performance standards, I would imagine that the conversation would have gone something like, okay, so you guys want to do baby dibbles? I'm not trying to knock dibbles, but a literacy assessment. And because of this model, we could say, actually, Head Start standards require you to look at all domains of development, including those in our early learning and development standards. And so then the conversation was like, oh, okay. Right, so those are examples. I think our coaches helped a lot. We used resources to scale up tools of the mind, and because tools is pre-K and K, right, we were able to get, that really helped get play back into kindergarten, which was just non-existent, yeah.
So I didn't hear whether you said whether there's a full day, full year, part day, part year.
Okay, sure. It was a full school year, full school day program.
So full day meeting 8 hours, 10 hours?
8:30 to 3:30, yeah.
Okay.
School day, yeah.
Okay. And I'm assuming by the way you say blended that all the kids were mixed up together in the same classes? Or
Yes.
you didn't have like a pre-K class, a Head Start class, a Title I class?
Right.
Okay.
And just depended on who you were talking to, right? If a parent came in and said, I'm looking for Head Start, we said, this is all Head Start. And if a parent said, I'm looking for pre-K, we were like, this is all pre-K. Okay, thank you.
Yes, thank you. My name's Janice Grundell, and I want to talk with you on the newer ideas side of this. I will acknowledge up front that there will be many skeptics in the room. I ask only that you don't throw your lunch at me before I finish. All right. I want to talk to you about a process that is now gaining a lot of steam across the United States called Pay for Success, and its companion partner, a process called impact investing, although some of you know it as social impact bonds. So right away, this is where people start to throw their shoes, because it is a conversation that includes a sector with whom we have not very much engaged, and that is the commercial sector, the for-profit sector out there, although some of you run Head Start that are actually for-profit, so it shouldn't be such a scary idea for us. I have 3 quick slides. I would encourage you to get the slides because they're information rich, and some of you will not be able to read them from the back. So let me tell you what's on them. On the Pay for Success side, which you should Google on your way home on the airplane, this is an initiative. It's not really an initiative. It's a new way of being in all of the health and human services that some of us have done for a very long time. Other people have called it pay for performance. Some people call it results-based accountability. The notion is that services will be paid for when in fact they achieve the outcomes that they were set to do. It's not a very strange thought. In fact, when you write the early Head Start grant, you're going to have to show that what you are proposing to do actually works. It's very attractive to government because of the way the financing works and because government can say to skeptical legislators, governors, I'm talking the federal government now, and other folks that we're only going to pay for what works. So it has limitations because that doesn't mean it will innovate. Innovation will have to happen in other places. This initiative called Pay for Success is really important to the Obama administration. 2 of its offices are key. One is the Office of Social Innovation. A couple of you asked me if that's where this is, and the answer is yes. The other is the Office of Management and Budget. That's really important because I grew up in a lot of these systems believing if you want to know a priority, you have to follow the money. So that the Federal Reserve is involved in this and the Office of Management and Budget is involved. It's focused on investments. I'm going to quote here exactly what they say because they say it better than I can say it, that measurably improve the lives of individuals while also spending taxpayer dollars wisely. Raise your hand if you disagree with that. Okay, good. We're on a roll. The next bullet point on here says the purpose of this pay-for-success approach and the financing models that are emerging to actually provide the new resources. The purpose of that is to leverage philanthropic, which we've all always done, right? And other private investors to provide services to a target population. Key words, target population. The government only pays if the agreed upon goal is achieved. That's different. The government always pays, almost always, whether we get there or not, right? And that's kind of how it works. We don't have really good outcome data. We have lots of process data. How much did we do? And sometimes how well do we do it? We're not yet able, although there are exceptions, to say, and here's the difference for this child, and here's the difference for this parent. It's just hard to get there, and we're not all there yet. In this kind of a financing model, we have to get there, and the government, if it is a party to this, will only pay back the investors if we actually get there. It also assumes that the investment will save money. That's what pushes this investment away from the back end of tertiary services to the front end of prevention. It's an upstream financing model, which for me as a child development person is like way overdue, and I'm really happy there are ways emerging that we can think about that. Examples, there are a bunch of them. Right now, in Massachusetts, one of these critters was just funded around reducing juvenile justice recidivism and paying for the outcomes of that. They know that will save money. In another state, Utah, which isn't here, and I know isn't one of Ann's favorite because the program model is not one we might like, they're doing one of these pay-for-success models in order to expand preschool and reduce special education costs through the 3rd to 6th grade. There are a couple of these emerging focused on homelessness. There's one in California focused on asthma reduction and hospital costs, and another one looking at how to reduce costs of elder care. That's what pay for success is. It's just paying for an outcome that you want. It makes some assumptions, however. It makes the assumption that you have data, more than 1 year of data, lots of data that says, this is what I'm doing, here are my outcomes, here's what it costs to get there, and here, this is new for us, here are averted costs. This is what the state government or the county government or the federal government didn't pay because, in fact, some of these programs actually really work. We don't usually calculate those things, but those of us who do return on investment arguments are really in that arena. The work is anchored in a process called evidence-based practice. I hate acronyms, but it's EBP. In our arena, there are several that are noteworthy. Some of you know about nurse-family partnerships. It's evidence-based practice. That's the basis of the South Carolina Social Impact Bond. And there's tons of really good material, and I'm going to give you the URL. Help Me Grow is an evidence-based practice that works at the intersection of early developmental screening and helping kids children get, birth to 5, to the services that they need. Parents as Teachers, some of you run those programs. Triple P is another one. Early Head Start, Child First, and cognitive behavioral therapy for the moms that I tried to talk about before. Those are evidence-based practices. You can find them online. They have models, they have fidelity, we know what they cost, and we know what they save. This arena of financing pushes us to be attentive and use those when they are relevant to the target population we're trying to serve and the money we need to take a good program to scale. You can't do this work without what's called a feasibility study. And when I was looking at the early Head Start requirements, all that data stuff, man, it looks like a feasibility study to me. And you need help to do that because an outside party has to actually verify that the data you're providing is true and valid and likely to continue. So the feasibility piece of this is just really good data-based practice that we all have to get to, and some of us are, and some of us have a little further to go. The other thing you have to do is you have to be able to develop a model that is called a counterfactual. That means, here's my answer to the question of what it would have cost you, government, if I hadn't done this. So on the child welfare side, man, I could do those. That's the world I just left. On the early childhood side, we have tons of data. Some of it, unfortunately, fortunately, goes out 40 years. This process is oriented around a much tighter time frame. So we're looking for benefits that occur sooner than that, not 1 year, but generally 3, 4, 5, or 6 years to make this investment. There are 3 national entities. If you're interested at all in this, you have to get to know these folks. One is called Social Finance. Another is called Third Sector Capital Partners. They're in Boston and San Francisco. And another is the Nonprofit Finance Fund. They all have remarkable information online that will help you even if you don't like social impact bonds and you don't like pay for success. Still, the rigor of the process of making this investment is very good for us because we have to think about return on investment and actually expanding what works. The websites for all of those are on the back page of these 3 slides. And then lastly, and this is one of those zeitgeisty kind of things, on March 27th and 28th, a whole bunch of us, it started out to be 80 and it ended up at 150, and some of my Connecticut colleagues were there as well as probably some colleagues from. We gathered in Charlotte at a 2-day training hosted by an organization called Ready Nation, www.readynation.org. Great resource, business people driving this argument. And that was all about what's a SIB, how do you do it, how can we do it, great excitement, who might funders be? So there was that at the end of March, and now we're here to talk about financing in a different context. On April 23rd and 24th, the National Governors Association is convening yet another group of us, and some of you will be in there, to talk about early care and education financing. So it seems to me that the money stars are aligning, and we need to be in the middle of that, which is, Joan talked about it from kids' perspective. I'll talk about it from how do we get the resources we need to do this. This is my second and last content slide. This is a chart as simple as can be produced for a complicated financing process. The document that it comes from was written by Merrill Lynch, one of those big banky financing investment guys, and Social Finance, which is one of the 3 organizations that I suggested you take a look at. And they tried to make clear for people for whom this was a new way of thinking what the actual dollar process is. It's really only got 7 steps. It's pretty straightforward. The deals are complicated. I'm going to use their word, the deals. We don't like those words, but if you're a financier, this is a deal, and this is you make an investment and you get paid back something if the outcome is achieved. If the outcome is not achieved, you don't get a penny. So it puts the risk outside of government, and that's one of the things that the Office of Social Innovation likes. So there are investors. This assumes you've done a feasibility study, and your outside consultant has helped you to make a really good argument that if you do this, these will be the positive outcomes. These will be the costs that you will expend and avert, right? We won't have to pay for those other bad things. And if we didn't do it, this is what would happen. So that's just good work. Then you have a bunch of investors. They tend to be private investors, family investors, but not through foundations, although foundations play in this role. Bank of America is one, Goldman Sachs is another one, JP Morgan, these big guys, right? They have money sitting in their houses of finance that are just sitting there, and they're looking for places to make a social investment where there is both, they have a good likelihood of getting their money back with a maybe small return. I mean, we're talking about little returns here, 2, 3, 4%, not some of the wild hedge fundy kind of stuff, where they're willing to take the risk to put the money up front. We're talking big money here, $20, $30, $40 million at a shot. And they sit there. Their job is to invest in us, those of us who want to move forward with some pieces of this. There is an intermediary which is created in a state to manage this process, because we're talking about lots of big money, and it has to be independent. And often you get to that through the 3 big intermediary organizations. Their job is to structure, coordinate, and manage the risk. The next piece is you and me, social service providers. Our job's to deliver the services, just what we're doing now. Only this provides money to do them at a scalable level with an outcome you believe you can achieve based on data that tells you that that's a pretty good risk. It's based on populations of need. Not everybody, it doesn't serve everybody. Evidence-based practices serve a very specific target population with a very specific model that's an advantage and a disadvantage, right? You can't color around the edges. You have to deliver it the way the model was developed, but we have return on investment data. So that goes to populations of needs. Results are achieved. There's an independent validator, again, because we're talking about lots of money, and they say, oh yeah, you really did it. You really did it. In which case, the government, which is usually a party to this, agrees to pay something. They usually share the costs of this. They make a payment that repays principal and return, and we get outcomes. It's very different than the way we think about paying for parts of the work we do. It's except at the front end. And so I think it stretches you. I'm watching people, I've been there really where people through shoes, and I'm not asking you to love it or adopt it. I'm not asking you to not be skeptical. I'm only saying that this is a train with regard to significant financing that's left the station in America. It's already chugging down the road in England. And it behooves us at some level to be smart about the process, because there are 26 or 27 states already engaged in this. And to the extent that it might be relevant to our children, the most vulnerable children and families, we need to know about it. So if you don't do it, that's really fine. If you do decide that you're sort of interested, then you need to go to these websites and see which of your states are engaged, and at least invite them to this table that you're going to create around early childhood. And then lastly, this is just a set of hyperlinked couple resources, right? Not a ton. I could give you an encyclopedia and you don't really need that. But if you take a look at any one of the top 4 short reports, very useful, and the 3 websites, you'll have a sense of where this initiative is going. So thank you for listening, and also for being open that this is a time of financing opportunity. Certainly the government is giving us an opportunity. Follow them. Oh, does anybody have questions? Also, I'm in the book. So, I mean, you have my email. And so if you think about this on the airplane flight home and you want to have a conversation and I can connect you with somebody either in your own state or elsewise, I'm very glad to do that. Yes, I think all the PowerPoints will be posted, so this will be very easy.
All of the PowerPoints are already posted on the website. If you just go to the front page of Build, under What's New, it'll say Early Head Start Child Care Partnerships, and you can click on them, and all the handouts are there as well.
Yeah, he wants to change the battery. Okay, he's going to change the battery. Go ahead, Janice. Question. I'm sorry.
Yeah, so can you go back to the slide before? I just wonder who's paying for the feasibility study, the entity that does the structuring, coordinating, and managing the risks, and the independent validator?
Yeah, that's a great question. There are 2 parts in that, and sometimes they're all the same, part of the whole process, and other times they're split into segments. The feasibility study, which has to involve you or whoever is proposed to deliver the services, costs between $40,000, which is what I believe it costs in South Carolina, upwards of $200,000, depending on how big you are and what the model is and how easy your data is. That's the no-go, no-go decision point. Philanthropy has paid for that. State agencies have invested money in that. I don't know if you could build that into administrative costs for this kind of stuff. It's data-based accountability, but those tend not to come from us because we don't have that kind of money laying around. So there's an external partner, and it's often philanthropy or a couple philanthropies who view that as an investment because whatever happens, you're going to know a lot more. So that's the independent first part. The second part, all the costs related to building this investment arrangement are part of a contract you write, and those are borne by whatever is the entity who makes the deal. So those costs are built into the back end. So if we can figure out how to do some of the feasibility work, it doesn't tap us financially very much at all. That's built into the back end. Companies do that. Lots of people do that. The one I'm most familiar with is a public consulting group in Boston where they're doing the Massachusetts back end. And that's really looking at the data elements and is the data coming in and what are the challenges. I don't think it's a big cost. I don't know the actual cost. A higher ed could do that, by the way. You know, we could use some of our systems to do some of this.
So a question about this type of financing. And I know Utah and others are doing it, so maybe there's a simple answer. We've explored when you do it with juvenile justice, when you do it with long-term care, something where you have institutional, you make the investment on the front end and then there's a payoff, and it's all within one system. So how does this work when the investment's going into early childhood programming, but the savings are probably being realized in Medicaid, K through 12, juvenile justice? So how does that work?
That makes early childhood the hardest arena to do this, although we know we have good return on investment data. So if you do your work right, it's going to reduce the child welfare neglect kind of demand. It's going to increase the efficacy of their money. It will reduce special ed that's in yet another system. It ought to reduce TANF expenditures, depending on how you structure this. It will reduce emergency room costs and hospital psychiatric kind of costs in the Title 19 sector. So early childhood work is more complicated because depending on the model you're trying to replicate, you have to have those partners at the table.
Did somebody have a question right behind Susan? I saw her hand go up. Yeah.
Oh, we just got answered. Thank you.
Oh, great.
If you look at the couple of reports on there from the Institute for Child Success in South Carolina, some wonderful, very clear explanations of exactly these kinds of issues. That was a great question, and it is the core, hardest question. Thank you.
Okay, thank you. Let me just take 2 more minutes and ask the panel a couple of questions. You know, all of these are really big ideas. Ann says everybody's got to pay. If we really want to do this, we want to do it right. Miriam, you say, you know, redo the whole school system and spread it all around. And Janice says go get a big investor with $40 million and that'll be great. Where do you start? I mean, what's your one, I mean, folks are where they are right now. We're really thinking about a smaller application, although we're doing it in the context of state systems. If you want to have a big idea around financing, what is your one suggestion of where you start?
My one idea for finance? One idea?
Concrete idea.
Whoa.
Give me 2.
I think that we have to use the resources we already have more efficiently and better together, because we're going to be better at doing this if we do it together. And that's where we can actually realize some savings. So we've got to really become, whether you apply for a partnership grant, we have to become better partners. And I think that will free us up to be able to do more. Because I really feel like we're at a point where, particularly with the Child Care Development Fund, it's time to say, man, it's broken as a work support system. It needs to be so much more and so much different. And we just have to start saying, we can only serve a small percentage of those who are eligible. Let's really say, what would it take if we did this right? What would it take if this were like the K-12 system where everybody gets to go, or higher ed where we provide scholarships and we make sure there are universities? It's like, we got to get over that this is just a small work support system. So that to me is, it's like the partnerships so that we can move forward together.
Miriam?
I would say nail down your vision. For me, it was get a big whiteboard and put it up there. But honestly, I think that's huge. And part of this, there were so many things that we didn't know how they were going to work, but we just kept coming back to the vision about what we actually wanted to do. And then the work became around getting outside of our tradition of the way we were used to doing things, and then just so everything just became a problem-solving opportunity. I don't know if that makes sense, but it was the vision. And then I think even when we set the vision, we didn't even start with numbers. I mean, I got lucky that, the numbers worked out, right? Because when we started adding ratios and how many caseloads and things like that, but it was just about what did we want to do. That was sort of our guidepost. You know, where we are with DC right now and thinking about how to blend again, you know, we might, you know, our big struggle is we might not be able to get to all of the kids right away. That bothers me a lot, but you know, we're just gonna take it in phases. So I think it's always different, but nail down your vision.
I can answer this one for me, but I will tell you as a preface that I wrote my first grant around this in 1995. And I want to tell you that that was 19 years ago, and those babies, I'm going to sound like Joan Lombardi for Pete's sakes, because we both are long at the tooth in this work. Those babies are 19, and some of them are having babies. So the patient's side of this causes me, because I'm getting older, impatience. So I just say that to you. Incremental change is going to take too long, and the world will change before we get to the point that we wanted to get to. So impatience and urgency, I think, is good. Now, that's not my point, so I don't want to, okay. So here's the point. As you do all of the data work required to do the early Head Start child care grants, there's a lot. You looked at that kind of stuff, the first two sections. Keep in your head that there may be other vehicles that you will be able to have the database to say, oh my gosh, this is so good. I have evidence to show how I could do more, how I could scale up, and what it will save. So if you just open that little piece of your mind and take that data, then it's going to cause you to say, follow the data, then follow the money, and look at extant money. I'm with you 100%. We don't use our money well. Follow the new opportunities, early Head Start, and keep open that some people in your states are already riding the train that I described, and you might as well have a conversation with them.
Let me thank the panel for inspiring us around the financing. It's hard to talk about, but it's important, and it's at the base of everything that we're doing. So thank you for having this conversation. For your next trick, and almost the final trick, we want you to meet in teams. And we want you to say, you know, what have been your ahas? What have you learned? What do you wish you knew more about? What agreements? You know, a lot of what I know about Head Start is there are a lot of MOUs that are written. There are MOUs that are written with disability, with every school district, with providers in the communities. And sometimes Head Start feels like they're the only ones who are genuinely signing those agreements. I want you to think at your table about what kind of general ideas, because people warned me, you can't really make the agreements because you got to go home and talk to other people. But what do you want to set out there as a potential place to get more agreement, to begin to do more work? Building your state system that then benefits your early Head Start child care partnerships. There's file cards on the table, index cards on the table. We really want one kind of agreement, commitment space from each state. We'll collect that in a little bit. But we want you to meet now as a team and talk about, so where does this leave us and what do we need to go home and do? It's so easy to go back home and get back to the job that you haven't done for the last 48 hours. So we want you to have a public kind of commitment to each other about what your next steps might be. And then we'll get a short, brief close from Joan Lombardi, and we'll have you out of here probably a couple minutes before 3. So team time now. Thank you.